Devastating wildfires continue to wreak havoc across Southern California. Hundreds of thousands of people forced to flee their homes and leave everything behind. As crews continue to fight the flames, there is another worry lingering for those in the area. That is wildfire smoke. So joining me now to talk all about the health impacts of wildfire smoke is our medical expert, Dr. Payal Kohli. Dr. Kohli, thank you so much for joining us today. I really do. I have, as you know, a lot of friends and family in the Los Angeles area. A lot of them have evacuated. Some of them haven't had to evacuate yet. Hopefully they don't need to, but I am concerned about their lungs.
Yeah.
So if you're in the vicinity and you don't have to evacuate, is that affecting your lungs?
I mean, it's devastating, Sam, to hear and see what's going on. And wildfire smoke has particulate matter, and that's small little particles that can get deep into your lungs. But it's not just your lungs, it can actually get into your bloodstream, because that's how small those particles are. And what we can see is short-term kind of effects on our health, but also long-term effects on our health. It can even affect our longevity. And we're talking about wildfire smoke, but the fact that homes are burning, buildings are burning, means you're burning lead, you're burning asbestos, you're burning furniture, which is releasing volatile organic compounds, and all the people, not just in that area, but for many hundreds of miles, are actually inhaling that.
That is very scary. I'm glad that you're getting the information now. I don't think everybody really thinks about that. So how do we know if wildfire smoke is actually impacting our health? Are there symptoms, signs?
So for most people, yes, and especially in the short term. So you think about inhaling it, it's going to irritate your eyes, your nose, your throat, your lungs. You can get coughing, you can get runny eyes. These are sort of the short-term effects. But the long-term effects, COPD or lung damage, heart attacks and strokes, dementia, impacts on your longevity, cancer. These are the ones that we don't immediately see. They can affect our immune system. We don't really see those effects either. And you think about the vulnerable populations that are out there, our kids. So kids that are exposed to wildfire smoke for several days in a row actually have a higher prevalence of asthma. They're more likely to develop lung disease long term. Elderly people who have less lung volume or reserve. Pregnant women, because when they inhale those particles and get in the bloodstream, that means it's going to the placenta and it's going to the baby. So really very devastating what's happening.
Wow. And we're looking at some of the imagery right now, and it's just all so surreal, devastating images. So wildfire smoke, you say, can affect our lifespan. You said that at the very beginning.
Yeah. Isn't that crazy?
Talk to us about that.
Yes, you're talking about 1.8 years reduction in our lifespan. And for firefighters, we're talking 10 years of reduction in their lifespan. So we don't think about the environment as playing as much of a factor as it does. But these toxins that are aerosolized can not just affect the organs directly, they can actually damage the DNA. They can change the way our DNA is expressed. So it's really very important for us to be cognizant of how close we are to that fire, how much our exposure is, because just like with everything in medicine, this is all about dose. So if you're getting a high dose of this wildfire smoke, either due to proximity, like a firefighter, or due to the fact that you have many days of exposure, if you live in the area, these are both dangerous conditions.
Are there any, would a normal mask work? Can you have a makeshift mask? What do you recommend to somebody that's there right now and for some reason they're not able to evacuate or leave?
So I would say don't recommend, don't exercise outdoors. It's really important to minimize your exposure. Wearing some sort of, N95 mask, because a regular mask doesn't do much to filter those small particles, but an N95 can. Keeping those windows closed and making sure if you have any kind of filters at home that you could either purchase or run to really purify the air, at least inside your home. These are all preventative measures. If you are having any symptoms, though, it's really important to make sure you seek medical attention.
Life-saving information, Dr. Kohli. Thank you so very much. We're so lucky to have her.